ჩვენ ვფიქრობთ, რომ მოეწონებათ ჩვენი პროექტი, იმიტომ რომ დღეს ძალიან აქტუალურია ეს საკითხი, განსაკუთრებით ჯანდაცვის სფეროში, ხელოვნური ინტელექტი ძალიან აქტიურად შემოდის ამ მიმართულებით ჯანდაცვის სფეროში, ძალიან ბევრი მიმართულებით, ბევრი სპეციალიზაციის კუთხით და ვფიქრობ, რომ საქართველოს ჩვენ პიონერები ვართ ამ საკითხში, მოსალოდნელია საქართველოსაც დაიპყრობს ხელოვნური ინტელექტი ამ დარგში და რადგან პირველებად იმედი გვაქვს, რომ მოეწონებათ ჩვენი პროექტი. I'm Irakli. I'm a co-founder of MyDoc, and I'm going to talk obviously about the MyDoc. Two major problems which are affecting Georgian healthcare provision, quality of provision of Georgian healthcare system is structural and process related. Structural one is that despite the oversupply with physicians in our country, there are most of the hospitals we are lacking proper channel of communication between physicians and patients, which leads to the inappropriate, ineffective, inefficient daily-to-day management and operations. For example, out of 30% of consultation, 15% of the 15 minutes goes to takes filling the documentation and leaving very little time for actual diagnostics. Another problem is related with the process delivery. And it's related in vast majority of the hospitals in our country. Unfortunately, the hospitals are lacking a modernized, automatized diagnostic decision-making system for doctors, which would lead them to the proper diagnostics. As an outcome, we get misdiagnostics, malpractice cases, inefficient patient and time management, and as an outcome, decreased loyalty of customers. We are looking at the nationally. We are looking at the private hospital sector, which is 90% owned by private owners of the hospital sector. This is about 2 billion lari market we are looking at. So. Given these circumstances, we developed a product which is a HIPAA compliant product, and it complies of two major things. The one is a messenger, medical messenger, and another one is a AI-based software which is symptom checker based. The physician, before the visit of the patient, is able to get all information regarding patient's symptoms, conditions, what he or she has, and also probable preliminary diagnosis. The doctor can communicate with the physician online, prescribe new drugs, prescribe new lab tests, set appointment or refer patient to another specialist. While AI supporting platform will support the doctor to ask correct questions which are related to the symptom, and which diminish quite significantly probability of error and misdiagnosis. So all this our system has a chatbot, a triage function, which gives an opportunity to the patient and a doctor to decide whether the situation is urgent while they are communicating, or before the communicating with the doctor, then to decide how urgent is the situation and to select where to go. And scheduling, of course, but then electronic health report records, online consultations, and documentation. So who we are? Our team consists of several, but three of main founders are here. Mamuka is very well known in Georgia, founder of MyVideo is a prototype of YouTube, and many other things. Tornike is 15 plus years experience in this field, and myself 20 plus experience in the healthcare management and hospital management especially. How we validate our product. Once we developed the idea, we brought our MVP hypothesis to the AVEX, which is the biggest private health hospital owner, and they liked the idea. So they collaborate with us. They tested it with their doctors. Later on, when we finalized our MVP, another big company, PSP, decided to test our product in their hospital sector and implement it in their hospital sector. So our goal is we are B2B company and will operate as SAS platform. Will offer to the private clinics to license our portfolio platform, and we'll charge each hospital per patient, and after 31st actual patient we'll charge them. So our first goal per Lari, and our first initial goal is 30,000 patients per month. Of course, we are worldwide competitors, which are worth of $10 billion, but they are too expensive for Georgian market. One, and second, they are also they are not tailored to the Georgian needs, and their programs is not exactly for the Georgian reality. So with this 100 grants, we will finalize our product. We will launch it with AVEX and PSP. Then we'll launch it nationally, start sales nationally, and then we'll move to the region, Azerbaijan and Armenia. And we'll hope that we'll be able to change for a better direction, quality of health service provision in this region. Thank you. Მაღალფერად რა თქმა უნდა, ეს უცნაური გამოცდილება არის ჩემთვის პირადად და ჩემი კომპანიისთვის. რა თქმა უნდა, ძალიან ამას ვწავლობთ, ესეც მონაწილეობაში, ესეთ შემთხვევაში ვწავლობთ მონაწილეობას. რა ვიცი, მომდევნო გვაქვს, რომ კითხვები იყო დაინტერესდნენ, იყო ძალიან ესეთი საინტერესო მანიშნებელი კითხვები, ალბათ რომელზეც ჩვენ თვითონაც უნდა ვიფიქროთ მომავალში. და იმედი გვაქვს, რომ ყველაფერი კარგად იქნება.